Hi, everyone. Welcome to the show. I'm Dr. Nicole, and today we're talking about types of trauma and how trauma impacts the brain and behavior of kids. Some of you may be aware of trauma that your kids have experienced in their lives. Others of you might be thinking, my child hasn't had any trauma. But I encourage you all to stick with us because we now understand that the definition of trauma is quite a bit broader than maybe we originally considered it. And it's something virtually all of us as parents and certainly as professionals working with kids need to be thinking about. For those of you with children who have come to you through fostering, through adoption, have kids who maybe have experienced significant loss, chronic health issues, family turmoil, whatever else, this episode is going to give you a really valuable way of thinking about what's going on in your child's brain and how best to support your kids who are struggling. So here to talk with us today about this is my friend and colleague, Robyn Gobbel. She is a licensed clinical social worker who loves coffee, pink, and everything about the brain. Once, fairly recently, her teenager went ballistic on her for getting another glitter coffee mug in the mail. Robyn loves cultivating deep, resonant connections with anyone who is up for it and is especially fond of all the grown-ups in the world who love and care for kids impacted by trauma, helpers, healers, educators, and parents. Her favorite thing is teaching anyone who will listen to harness the power of neuroscience so they can cultivate deep, resonant connections. This would change the world if we could all do that. To be seen, to be with, feel, and deeply know each other and ourselves. Robyn really believes that this can change everything. I agree with her. I have been waiting to have this conversation. Robyn, welcome to the show.
Thank you so much for having me. We are going to have fun.
This is going to be great. And I really wanted to set the stage for everybody, regardless of how they think about trauma or whether they think it's an issue, to stick with us, because really everything we're going to be talking about today is relevant to all kids and to our understanding of any kind of behavioral issues that we might be facing.
Yes.
So let's start with just you sort of sharing briefly how you got on this path of really focusing on kids who have experienced trauma, their families, and the neuroscience piece.
Yeah, that's like, people always want an answer to that question. It's like, I've always wanted to do this. Like, since I was in high school, I remember reading what I would now call like a memoir of this woman named Tori Hayden. She's a special educator, and they were in my high school library, and I just found them and started reading them. And I'm like, I want to do, like, this is what I want my life to be like. I want to do what this lady does. And now I can look back and I can remember those books, and I've reread them. I have all my originals still, and be like, oh yeah, what I wanted to do is like work really, really intensely, really connected with the kids that nobody had any idea what to do with. Like, everyone was just baffled, and she was baffled too, but she was like, oh, well, we'll figure this out. Let's just get in there and be with them. And now I look back and I'm like, that's why I loved those books. Cause I was like, well, yeah, that's what I want to do too. And then I went to graduate school, did all my formal schooling and training, and realized that a lot of those kids with those biggest, most challenging, most baffling behaviors, needed the most help, had experiences in life that we would now call trauma. Mm-hmm. And then somewhere along the way, I also had many opportunities to get really deeply connected to our local adoption community when I was living and working in Austin, Texas. So I kind of just put those all together, right? My love for the kids that needed a grown-up to be like, I will be here with you until we figure this out. Like, I wanted to be that grown-up, and I wanted to help their other grown-ups become, that person for them too. And then adoption. And then, also really getting connected to trauma and trauma-informed care. And then ultimately discovering what we would now call the field of relational neuroscience. And then I've just pulled all those things together.
I love it. I don't think that I've ever met another person, or certainly have not interviewed anyone for the podcast, who was influenced early on by Tori's books. And you said that, and I was like, wait a second, that was one of my favorite books. And I wasn't exposed to her writing in high school, but in college, going through my special education program, that was required reading. And oh my goodness, I have read that book several times. So powerful. So wow, something I didn't know about you.
Yeah, that's fun.
I love it. And I'm so there with you of, back before we knew even half of what we know now about the brain and all of this stuff, you and I and, some of our colleagues were just like, let's figure it out. Like,
yes.
I didn't know all the science behind it back then. Nobody did. All I knew was these are kids who are really struggling, really hurting. As you said, nobody else knows what to do with them. I don't really know either, but I can be here with them and I can connect with them and I can love them. And, in a lot of ways that was enough. And now we know so much more. And so I'm excited to dive into the neuroscience of this because I think the research has really started to catch up with those of us 20, 25, 30 years ago, just sort of instinctively doing this.
Mm-hmm. Absolutely. Yes.
So before we get into the science of it, I do want to have you really sort of lay the foundation here by defining what do we mean when we say trauma? Because I think that most of the time when people hear trauma, they think about a big, isolated, traumatic event, like the death of a loved one or a major car accident or a house fire or, something like that. And so I'd really like you to just give us the foundation here by how do you define trauma? What do we need to be thinking about with trauma?
So when I think about trauma, and it isn't a term that is well defined across disciplines. And so we do all use it in our own kind of unique and nuanced way. When I think about trauma and the word, specifically that word trauma, I think about, not only an experience, but then what happened after the experience, what happened in the individual's support system, who was there for them. And that then is related to how did that experience get processed in the brain and body and nervous system and our regulatory circuits and our memory processing. And we could go into all of that kind of stuff, but just how did, what was the experience? What was the impact it had? And how did our brain and body and mind respond to it? Ultimately, the specific experience kind of becomes almost the least focused on thing that we're, at least when we're thinking about the definition of trauma, because you and I could have the exact same not good experience happen at the exact same time, and how it impacts us is going to be wildly different based on so many things that were happening in that exact moment, as well as our, previous experiences, everything that had led us to that moment. And then what happens after that moment? Who's there? How does my story get told? What happens in those, moments and days and weeks afterwards? So trauma, then I guess to get a little more succinct for me is, the experience, but then what happens after the experience? How does that blend with all the things that had happened before the experience? And ultimately, it's about something that overwhelms our system, overwhelms us in the moment, and our functioning and our ability to kind of process and integrate that experience.
A couple things there that I think are so important to spotlight. One is how you said that two people can have exactly the same thing happen to them or go through the exact same thing. Like two children in a family or two family members could go through the exact same thing. And one may move through that and not have lasting, serious issues, and another could. And so I think recognizing the individuality of that is important. I also want to touch on, this idea, I don't actually know who first put this out there, but this idea of like big T trauma versus little t trauma, this idea that it doesn't, that trauma is in the eye of the beholder, right? And it doesn't have to be some huge, like life-defining event. There can be lots of smaller traumas that build up over time. And so I'd love to have you just talk a little bit about that.
Yes, I heard that word for the first time ever, big T versus little t trauma, like early in my career, probably in EMDR training.
Yeah.
And I think it's useful to consider that. I think it's also useful to go beyond that sort of language. But what I learned, when I learned like big T versus little t trauma, it was like, single incident trauma, like you said, like a car accident or a house fire or, a hurricane, right? One specific incident that occurred that then impacted how our brains and bodies and minds like integrated and processed that experience versus what we could call little t traumas, or we could move into language like complex trauma,
Yes.
developmental trauma,
Yes.
attachment trauma. Again, one day maybe somebody will define all these terms. We'll have like really consistent language, but until then, these taking us kind of step back and recognizing that the frequency of, maybe we could say, less intense experiences, but that they are happening. Although I don't even like to say things like that, because who am I to say intense versus not intense? But the frequency of experiences that occur repeatedly, that we wouldn't necessarily look at just one of them and label that a big T trauma. But when we step back and look at the frequency and the time in between, right, that happened, that there wasn't enough recovery time, or, that then those experiences happen repeatedly over time. And it doesn't even have to be something we look at and say, this thing happened. For example, in the pandemic, one of the things that's happened repeatedly is social isolation. So as opposed to something happening, it's almost like a lack of something happening. And that happened, over a long period of time. And it happened in the context of a lack of kind of social or cultural safety, and that those things have added up over time. And without question, some kids now, it's completely accurate to say, have experienced trauma because of the pandemic.
Yeah, adults as well. I mean, we're sort of collectively living with the trauma of all that. I think that that's a great example. So I think this idea too, that sometimes our perception of it, I mean, actually all the time, like our perception of how another person has experienced something, or how a child has experienced something, is really irrelevant. It's about how that individual experienced it. And I want to raise this in the context particularly of something that we see quite a bit at our clinic in the community of adoptive parents who don't recognize the process of adoption itself as being a trauma in the lives of kids, and who will say, I don't get it. I mean, we adopted him or her at birth, or, we brought him home when he was 9 months old. Like, there wasn't any trauma there. Like, I don't get it. And not being able to take the perspective developmentally, as you were saying, of what that was like to be in the brain and the body of that baby in utero, of that newborn, of that infant. We look at it through the lens of just our own experience, and we fail to recognize what's really going on there.
Yes, absolutely. Adoption's a good example, especially if we just look at the infant adoption, maybe relinquished and then placed in an adoptive family right at birth. And so we're going to pull out abuse and neglect that we might see in other sort of adoption experiences, that we're, when we say that wasn't a trauma, we're looking at several different things here. One, we're not totally understanding how infants and newborns and even babies still in utero are taking in and processing the world.
Right.
That's simply because they don't have like recall of those experiences. Their memory networks are still, alive and well and working and storing those experiences inside their memory networks. They just have recall of them. So I think that's one piece. I think we're also really minimizing what it means to be a teeny tiny brand new baby in the world who's expecting one thing. Because babies do come into the world expecting what they were prepped to come into, and they were in utero, and they could hear things and feel things and all that kind of stuff. So the fact that something different happened, even if we could, and we can't always, but even if we could objectively state what happened was better,
Mhm.
right? They ended up in a better place, which doesn't actually always happen in adoption, but let's
Right.
just
Yeah.
consider that it did.
Yeah.
That it's still a trauma because it wasn't what was expected. But then the other thing we really overlook is remembering that as kids get older, they go through different developmental stages, and their story and their narrative means something completely different and new to them. So how a 3-year-old is interpreting adoption and what that means about them and their life experiences is wildly different than what a 15-year-old is thinking. And so that 15-year-old's experience, what they're bringing to that informs how much of a trauma that experience
Mhm.
feels like.
So true. And I think that's such a great point about, regardless of what type of trauma it was, how that lives in the child and how that evolves as they go through critical developmental stages. That's
Yep.
really an excellent point. And so parents who maybe feel like, well, we're out of the woods, the adoption or the major life disruption or the traumatic thing that happened, they seem to be fine with it. Sometimes we could be really caught off guard then in the teen years, for example, when that really crops up. And so our awareness of that throughout the child's developmental process, that's really, really important.
Yes. It's
Yeah.
something I spend time with actually when I work with families clinically. If we start to wrap up our work together, I just like to kind of lay the groundwork for them that we're wrapping up our work here together, but don't let it blindside you.
Yeah.
If, when your child turns 12 or 15 or 21, or they become a parent or whatever milestone happens, if this begins to reemerge, like just don't let that blindside you. That's normal. We can expect that that's probably going to happen. Really, I think helps lower the feeling of crisis feeling. What did we do wrong? How did we cause this? If families are kind of prepped that, at each developmental stage, we kind of reintegrate our past experiences. They mean something new to us.
Yeah, for sure. So let's get into now how trauma impacts the behavior of kids. And we're going to talk about that via the neuroscience of really what trauma is doing to the brain. And to me, this is so important for all of you listening who are raising kids, who are teaching kids, who are doing therapy with kids. When we can understand this, when we can understand how these experiences shape a child's brain, it lets us really look past the behavior and support it in such different ways. So let's start with, at a brain level, what do you think are the important things for parents, teachers, caregivers to understand about how trauma impacts brain development and brain function?
I love that question. And I actually want to start somewhere different first, if
Great.
that's okay.
Do it. Yeah.
Where I've loved to start now, because what I have discovered over the years is we have unintentionally turned the idea of trauma-informed care and trauma-informed practices and trauma-informed parenting into another kind of behavior management technique.
Yeah.
Right. And so I've paused to figure out, like, why? How did this happen? Because it happened unintentionally by wonderfully amazing, well-meaning humans. So how did this happen? And what I realized was, it's like, oh, because we still are laying the idea of trauma-informed care and trauma-informed practices and the impact of trauma on behavior on top of outdated views about behavior in general.
Yes.
So just super briefly, let's start there, because I feel like we have to layer trauma-informed care on top of that.
Great.
But without question, I mean, since I was in graduate school and what I learned about what behavior is, and I don't know that I've ever told you this either, but I started my undergraduate training as a special education major.
Okay.
So I started in the education department and then shifted over to the psychology department, not until like the end of my junior year. So I also had a probably similar training but from the special education world about behavior and what behavior is and what do we do with it. And I'll just succinctly say, we've just learned so much more about where behavior emerges from. And so when I start with working with a family, or when I start teaching, I like to kind of go back to ground zero and say, what we learned about what behavior is, we've learned something new about what behavior is telling us. And I have kind of these three things I'll usually talk about. And one is simply let's just agree that behavior is only information. It's something we see on the outside that gives us some clues
Mhm.
about what's happening on the inside. And we can get all into autonomic nervous system and affect regulation theory and attachment theory and all those things. But usually I just say, just trust me on this one. It's just clues. It's just clues. We're just going to take it as data. It's just information that lets us go, that's interesting. I wonder what's happening underneath that. Why is this behavior happening? And then the second thing I, always teach is one of my pillars. And again, and I keep reminding people, this is about all people. This isn't about trauma yet. We'll get to the trauma piece. First, let's just agree on what, like, kind of the neurobiology being human. So then my second one is connection. And we know this from the science. Connection's a biological imperative, meaning we're all always seeking connection. Always. It's actually our default. We're expecting it. So when kids are behaving in a way that's like pushing connection away or making us not want to be connected with them, right? Like you and I are parents. We probably don't have to go that far in our memory banks to remember a time our kid was doing something that was like, I don't even want to be by you. Right.
This morning, I don't know.
I know. I mean, it was just, right. Exactly. It's not that that's not real. Like that really happened. It really was a behavior that's pushing away connection. But when I am my most regulated self, I want to pause and go, well, that's curious. What's up with that? Like if connection is a biological imperative and we're all always wanting connection, seeking connection, we prefer it, it's our baseline. Why would we have a behavior that is clearly pushing connection away or not letting connection in? Right. So just more curiosity. So that's number two. And then my third one is just a summary of all the relational neuroscience. For me, I kind of bring it back to here's what we know is that regulated and connected kids who are feeling safe, they're doing well. Like they're behaving in ways that the adults are going, yeah, we like that. Right. So when we have a kid who's not doing that, whether in the moment or like pervasively, to pause and go, okay, so is this about regulation? Is this about connection and attachment? Is this about felt safety? Which again, all of those are big topics that we could spend lots and lots of time on. So those are that's my three things. Behavior is just what we see that lets us know what's happening on the inside. Connection is a biological imperative. Regulated, connected kids who feel safe are doing well. And this, again, I go back to is true about all kids, but also all humans, all grownups, me and you too. Right. And brings us to a new understanding of what it means to be human. And that I think that pulls us back out of this, again, unintentional place that we came to by very well-meaning humans of trauma-informed care having been turned into another behavior intervention.
It's so true. And that's happened in so many different ways beyond even just trauma, but when we operate out of the framework or the core idea that we just look at what's on the surface and the goal is to stop that.
Yes.
We might be successful in doing that with our behavior charts and our rewards and our punishments and our whatever, but we never really get beneath that surface level. And I think that's why so many parents, as their kids start to get older, and I know people in schools have this experience too, it becomes like this game of whack-a-mole, right? Where it's like, okay, I got that particular behavior down, or I've got them to stop doing that, but now these other things have popped up. And it's because we fundamentally aren't viewing the behavior as just the red flag, as the tip of the iceberg. Right. We're not looking deeper and saying what's actually going on here. And so I think fundamentally that's so important for us to approach child behavior, adult behavior, human behavior in that way. Yeah.
I agree. And then there's been this way that we've come to believe that if we do get curious about behavior, somehow that's synonymous with just like letting bad behavior go.
Right. Yeah.
And it's absolutely not.
Right.
Like, both are 100% possible. We could be completely curious about behavior and do things that communicate this behavior is not working for me. So you and I have to figure out how we're going to adjust.
Yeah. Both things can exist at the same time. Yes. That's very important. Yeah.
Absolutely. Yeah. So then if we want to go to the next step of like, okay, so how does trauma impact that? Well, trauma impact, the words that you've heard me say are like regulation and connection and felt safety, right? Trauma impacts how our regulatory circuits are formed if the trauma happened early enough in our life. Meaning, when I'm using the word regulation, I'm thinking about like the energy and arousal that's underneath, that's underneath and driving our behaviors. That we all have like go, go, go energy, and we all have stop, stop, stop energy. And when the energy is regulated, our behaviors tend to make sense, right? Again, regulated behaviors aren't usually the ones that are driving parents to listen to behavior podcasts, right?
They're behaviors that match what's going on in the situation.
Exactly.
Like I can be aroused and busy and running around and when I'm outside and playing, and I can manage my body and my voice and myself in a way that's quiet when it needs to be. Like that's the idea of what it means to regulate ourselves. Yeah.
Yeah. And we can even be mad, but just like you said, it makes sense.
Yeah.
Like we can all look and be like, well, of course you're mad. It makes perfect sense that you're mad right now. And you're not totally losing your mind or flipping over desks. You're mad. And I get it. Right. So regulated doesn't mean like calm and zen all the time. And then the way that trauma and experiences of, harsh care or dangerous care or an absence of care during the time when these regulatory circuits are forming. And that could be really severe, like things that you and I would easily look at and say like, yes, that was abusive or neglectful. But it also can be a lot more subtle than that based on, as parents, kind of our own experiences being parented, the stress in our lives in this moment in which we are parenting, can absolutely impact just like how present we are for our kids, how attuned we are for our kids, how well we are able to be with them and offer them the co-regulation that they need, right? It doesn't have to look exactly like what we would easily label abusive or neglectful for our children to have some impairment in how their regulatory circuits are built when they're, brand new babies, toddlers, preschoolers, when this autonomic nervous system is really getting built. So trauma can impacts our regulation and turns us into what most parents are very familiar with, which is this idea of like the mountain out of the molehill phenomenon, where you're like, there's a small problem. We can all agree, usually there's a problem. It could be as simple as like, no, baby, dinner's in 5 minutes, so we're not gonna have a snack right now. I'm like actively plating dinner for you, right? And then the reaction is as if you've just said you're never going to eat again for the rest of your life, right? There's this like, sure, there was a stressor, but it was a small one compared to what the reaction was. Right. And so there's a lot of things that are going into that. One of them is just impaired regulatory circuits that, my 15-year-old, when I say, no, baby, we're going to have dinner soon. Let's pause and have that after dinner if you're still hungry. He's disappointed, right? He wants what he wanted right now. He's disappointed, but his regulatory circuits help him manage that disappointment. And also he trusts me that really I'm about to feed him soon. Right. And the feeling of hunger in his body isn't going to last forever. Right. And so his regulation is helping him kind of just tolerate that disappointment and tells him an accurate story. Like, yes, I really am going to get dinner soon. Yes, this feeling of hunger is going to be over soon. Yes, I am going to get my needs met. So then if we look at the connection side of things, a lot of, especially when we think about complex trauma, developmental trauma, that early attachment trauma, that those traumatic experiences either happened inside the caregiving relationship, or in the instances of like medical trauma or other traumatic experiences, that things that can happen to really small children that are the parents really not involved. Like they didn't do it to the child, but because of the circumstances, they're also not really able to help the child co-regulate that experience, or frankly, just stop the experience, right? Like when our kids are hurting, when they're tiny babies, one of the things we try to do is to get that hurt to stop. Like in the instance of medical trauma, we can't do that. And not only can we not do that, but maybe we're actually like standing by
Mhm.
while the child is experiencing more pain.
Mhm.
And we have to, and we're not doing anything wrong, but the child's experience and their nervous experience, system experience is, I'm not getting what I need. My parent's not helping me.
Mhm.
And so when these experiences happen inside the connected relationship, what can happen is that the kind of child's nervous system learns that connection both is exactly what they need and want, and also is scary,
Mhm.
or it hurts,
Mhm.
or they don't get what they need and want there. And then that kind of conundrum creates some baffling behaviors, right? Like if I have something I need desperately to be okay in the world, like connection. Also, I've learned that that thing hurts me or doesn't get me what we need. And both are true. I need it desperately and I'm afraid of it. That combination results in some behaviors that we could just call bizarre,
Yeah.
strange, baffling.
Yeah.
Yeah.
What's coming to mind too, as you talk about that sort of that conundrum there that kids have of like, I need you, I want the connection, but it has caused pain. It's overwhelming. I think
Yes.
even, about all of you who are parenting or working with kids with neurodivergent brains, kids
Yes.
maybe who from very early on are very overwhelmed by the sensory environment or the
Yes.
ways that we typically engage with and communicate with young kids is very overwhelming and adverse to their nervous system. And it's that same sort of like dilemma in the kid, right? Of like, I desperately need and want this connection with you, but it's also super overwhelming and like, I can't handle it. And so we get all of these really dysregulated behaviors that come out of that then.
Yes. And then the parents often aren't aware that
Yeah.
what's happening is that their child is processing information
Yep.
differently.
That's right.
And when you don't know that that's happening, almost always the story you tell yourself about that is that it's your fault.
Yeah. Yeah.
I'm a bad mom. I'm doing, and then that story that we weave
Mhm.
can have an impact on connection as well.
Yeah. Yeah, absolutely. So
Yes.
many ways that this shows up in kids and then the stories that parents tell themselves about that. And then we have the piece of, well-meaning, but really not helpful or accurate information and advisement that parents are given about how to handle this stuff, right? Because as we shift gears and start talking about, well, what can parents and caregivers do about this? We have to acknowledge that one of the core issues that comes up when parents try to seek help around something's not going, but like something's not working here. What do I need to do? If they're advised in ways that go back to that old behavior paradigm that you were talking about of like, rewards and punishments, all of these kinds of things that historically, behavioral kinds of approaches, wow, we can really make things worse, can't we?
Oh, yeah. Unintentionally
Yes,
so.
right,
And
right.
yes, and I think it's so important for us as professionals to just have a moment of pause where we realize how much power we hold in families.
Yeah.
And really, it's so important, I think, for us to start every single day, maybe every single appointment, but we're remembering how much power we hold in people's families and how people do what we tell them to do.
Mhm.
And so let's get really clear
Yeah.
about how we're handling that power. And
Yeah.
yes, I think one of them is, making sure that we're understanding,
Mhm.
in the best to our ability and what information we have to us right now about what behavior really is, whether it's about a kid with a history of trauma or not, but
Right.
what behavior really is so that we can really empower the parents
Mhm.
to see that themselves
Mhm.
and then have tools that actually solve the real problem instead of, I loved how you said whack-a-mole, because that's exactly the language I use. Like we're
Yeah,
just playing behavior whack-a-mole.
that's right.
Sometimes we're successful, but then the behavior just pops up somewhere else. And we never stop that kind of frantic feeling of how do I get this to go away? How do I get this to go away?
Mhm.
Um, And if we can really take a step back, like that feeling stops, right? This whack-a-mole, try, that can stop. And that brings such a powerful change to a parent-child relationship too.
Right. Absolutely. So let's think about then, let's give people some, one or two specific things that they can be doing or thinking about, because these kids really do need a unique form of parenting, right? There are some shifts that we need to make, some things that we need to understand. And so I'd love for you to share a couple of really tangible things, and preface that by everyone understanding that these things that Robyn's going to talk about are actually good and important for all kids. So if you are a parent to multiple kids, or you're like a teacher in a classroom or whatever, and you're going, oh, great, I have to have like one specific way for this kid and another for this kid. Nope. Actually, what we're talking about here is fantastic and works for all kids. So just want to put that out there as something to keep in mind. This will actually make your life easier with all of your kids.
Yes, very much so. Okay. So yeah, let's talk about practical stuff, because absolutely none of this information is helpful at all if we have no idea what to do with it. So I like to start off by saying that there's some things that we're doing practically that we might not label as being practical. And truly, it really is a practical intervention to just be changing how we're seeing behaviors. And it's practical for probably a lot of ways, but the two ways I really talk about it, if we can just see oh, this isn't about my child being controlling or manipulative or, just whatever run-of-the-mill bad behavior. This is about my child struggling. If we are just shifting that lens, we're doing two major things. One is our child sees something different in our eyes when we're looking at them. And that is an intervention. It really matters. It changes things. It might not change the behavior instantly in the moment. And I get that, but it does change things in the long run. And so I say changing how we see people changes people. It is an intervention.
Yes. Love that.
And then, the other part of that too, is it changes my own physiology, right? When I'm with somebody who is just honest, there's just no two ways around it. They're behaving bad. I'm not trying to convince people other people's behavior is not bad. It's bad. Yeah. But if I can see it some of the time, right? It just is not possible to do this all the time. But if I can do that just some of the time, and I can see that person is struggling and still know, that doesn't mean they get to do it. I can still have a boundary, but let's start with they're struggling. That changes my inner physiology and it keeps my nervous system. I talk about our nervous systems being in either connection mode or protection mode, either experiencing felt safety or not experiencing felt safety. And if I want my child's behavior to change, they need my nervous system to be in what I call connection mode. If I'm dysregulated, if I'm in protection mode, if I'm seeing my kids' behaviors as just the result of them being a really bad kid, then my child doesn't have the opportunity to experience me as kind of their beacon of felt safety in that moment. And so even though I know parents feel like it's not practical, just tell me what to do, I do want to, and I can do both. I promise I can do both. It can also give you things to actually do, but they have to be grounded on top of this shift. It truly is an intervention, right? To just really change how we see behavior.
Yeah, to change how we see behavior and to be willing to focus on changing ourselves.
Yes.
Because so often, and again, in that old paradigm, the emphasis is on changing the kid. Yes. And understanding behavior now, as you've talked about, and as we understand it, it really forces us to shift the focus to ourselves and say, how do I need to change myself and bring myself to this situation so that my child can be more regulated, can get their nervous system together, and we can move forward. And that's a huge difference. A mentor of mine told me, I don't know, probably 20 years ago now, a kid can only be as regulated as the least regulated adult in their environment.
Yes.
Oh, if we start thinking about that, suddenly we go, oh, I have a little more of an understanding, if we're willing to be honest with ourselves, right? About why our kids are struggling. A lot of it is, where are we as the key adults in their life, and what are we modeling, and how are we managing ourselves?
Absolutely. And I know you do this so beautifully in the work that you do, that also reminding parents like, hey, we're human too.
Yes.
Right. That like we can say these things and we're like, your kids are only as regulated as the least regulated person in the room. And honestly, my first thought is like, oh no,
Yeah.
like,
Right.
this is
Yeah.
not going to work out well for my
Right.
child. And then
Yeah.
and then taking a breath and
Yeah.
pausing it and being like, okay, actually,
Yeah.
there's so many things that I can do to support my own regulation, that my child deserves me to do those things. I deserve for me to do those things for myself. And so does this is again, not like, this is your fault, caregiver. This is, and I know so much that's nowhere near what you
Yeah.
feel or think or believe or put out into the world. It is still so easy as a parent to be like, oh no,
Yeah.
oh no, oh no, oh no. So just pausing. And for me, my really most practical first steps are like, notice your reaction, notice that you're about to really flip your lid on your kid. Just acknowledge that that's actually what's happening, instead of trying to talk yourself out of it, or I shouldn't be reacting this way, or all these things we tell ourselves. And then pause for a moment of self-compassion. This is hard. This parenting gig that we have, even in the best of circumstances, is hard. And then we add in, parenting kids who have experienced really hard things that have happened to them, and whose nervous systems just aren't fitting what we would call like the neurotypical norm. And we still have so much work to do to make the world a safe place for them. And we're working on them, but it's not there yet.
Yeah.
Right. And, just like pausing to acknowledge that these things are true. Parenting is hard. Being with dysregulated kids is hard. Even when we know, quote unquote, what to do, it's still so hard.
Mhm.
Lots of self-compassion, and then kind of just a big breath.
Mhm.
And then,
Yeah.
okay, now what?
Yeah.
And so then I go back to my question of, okay, if regulated, connected kids who feel safe are doing well, what's up with my kid right now?
Mhm.
Is this a felt safety issue? And do I need to look at what's happening in their environment? What's happening with me? What's happening with my kids' inner physiology? Sometimes our kids aren't feeling safe because they're ill, they're tired, there's a enormous amount of information, things that could be contributing to our kids not experiencing like felt safety in that moment. Right. Or we can look at connection. Is my kid not feeling connected to me right now or overall? And as a full-time working mom, that's a place I go to a lot, and not out of mom guilt, because I don't really have a lot of mom guilt about being a full-time working mom, but just a reality check of like, am I more disconnected from my kid than usual right now? And as part of what's happening right now, his way of letting me know that he's not getting what he needs from me right now. And do I need to just kind of call a pause in this moment and just be present? Do I need to do bigger picture things? Do I need to look at what my work hours are? I mean, we could ask ourselves lots of questions. And then, regulation. Is my kid not regulated right now? And I really love this question, because I think there's so many ways we can get creative about supporting our kids that have nothing to do with traditional behavior management, right? Like, in my home, that looks like making sure my kid has snacks during homework time. That makes sure my kid, I think to myself, when was the last time my kid went outside and moved their body? That makes me remember that what my kid needs to feel regulated and what I need to feel regulated aren't the same thing.
Yeah.
So when he likes to do his homework while he's listening to audiobooks,
Mhm.
and my first reaction is, oh no, 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 no. Like, we don't do homework while we've got words in our earbuds. And I pause and I'm like, well, is he actually doing it?
Mhm.
Okay. So maybe there's something about that that's helping his system feel regulated,
Yeah.
and then actually able to do what he needs to do.
Mhm.
So I'm thinking a lot, when I'm looking at bad behavior, I am really thinking, when was the last time he ate? Does he need a snack? What kind of a snack does he need? When
Mhm.
was the last time he had a drink? If I got my kid a drink through a thick drink through a straw, would that help?
Yeah.
Because sucking things that are thick
Mhm.
helps us come into regulation. And I think that's just a so much more fun way to parent. Like I would so much rather be thinking about those types of ways to help my kid feel better than be thinking about like what sort of punitive consequence do I need to give out
Right.
in order for his behavior to change. That's just it's just exhausting to me. It's not a very fun way to parent.
No. And I think even, when we may not ever figure out what's really going on under that. We may take, sometimes we just don't know. I've had that with my own kids. I've had that with kids, patients that I've worked with. Like sometimes we don't know, but there is something about our presence of being oriented in that direction of like, I don't know exactly what's going on here beneath this, but I know there's something. And I'm going to try to figure it out. But even if I don't figure it out, there is still such a benefit in my presence with the child in that scenario of appreciating the fact and coming from a place that I know there's something going on here, even if it doesn't make sense to me or I don't know what it is. And that connection then has such a benefit for kids too. So if you're like, I don't know what it is half the time, that's okay. You might not, but just thinking about it in that way, I think is beneficial for building trust and building safety and regulation.
Yes.
Yeah.
Yeah. And then so often what happens next is parents are like, okay, this is great. I love this idea, but what about a consequence?
Right.
How do I actually teach my child that like being mouthy to me or disrespectful or screaming at me, that they're not going to do their homework? How do I teach them that that's not acceptable? I'm like, oh, that is such a great question. And let's go back to what we know about what it means to be human. And it is that connection to biological imperative. We want to behave in ways that promote social connectedness and social relationships. So generally speaking, if we help kids feel regulated, connected, and safe, they know, like they are behaving in ways that are, those are the behaviors we're looking for. Even though we haven't given them a consequence to know not to do those other behaviors, it's for a lot of times, not always, a lot of times that behavior is just going to emerge. But then I also like to ask parents this because the answer is always the same. And I ask, does your child know that it's not okay to talk to people like that? Or does your child know that it's not okay to hit people when they're mad? Yes, they know. Okay. Well, then we actually don't have to teach them.
Right.
They do know. And they know because you're a great parent.
Right.
And you're so clear. Of course, my kid, of course, knows the, respectful, appropriate way to communicate with other people, right? He doesn't need me to punish him to know that. Right. So it's not, the question really isn't, well, how will they ever learn? Well, they learn in all the other moments. And we can still, once our kids are regulated, once they're connected, once they're feeling safe, we can go back and revisit, does my kid need some additional boundaries that are helping them, be more regulated, be more connected, and be more feeling safe? Does my kid need a little reminder that in our family, we work really hard to be kind to each other? Sometimes my kid does need that reminder. I've given it to him recently. But it didn't come in the form of a punishment or even a consequence. It came like truly in the form of like, hey, let's talk about this. Like what's been happening lately? I know that, in our family, we really value being kind to one another. What's up? How can we help you? Right. And I'm not worried he's learning it's okay to act this way. He's completely clear that it's not okay to act that way. And honestly, he doesn't like acting that way anyway. So if I can help him and again, still give him a lot of boundaries and consequences aren't synonymous.
That's right. Yeah.
Our kids need lots of boundaries, and there's so much opportunity to really support them by giving boundaries. That doesn't mean we have to give them a punishment though.
Yeah. No, such an important distinction. And I know you have so many resources and great things available to help parents know on a very practical level how to implement these things, how to bring these things to life in their own home, for professionals working with kids and families in therapy settings and schools, all of that. So as we wrap up here, I want to make sure that people know where they can find all of those great resources that you have available.
I would love to get as many people across the whole wide world connected to so much of this, because so much of it's free. I have a ton of free resources like you do. I have a blog and a podcast and an ebook on attachment that's just free. Just access it, no cost, nothing. And then I do have some more in-depth opportunities for families. I have a parent course for families, a digital, totally on-demand parent course. I have a virtual community for parents where we really, again, we practice the very practical skills on top of what do I need to do as a parent to take care of me, so that I can, remember even what these tools are, right? Like when we're dysregulated, we don't even remember what the practical tools are, let alone actually use them. That's not because we're bad parents. It's because we're not regulated enough either, just like our kids. And then I will be offering very soon in 2022, I am going to be offering a brand new program for professionals for, an immersive experience for professionals who really want to be able to work with families in this way of giving them very practical skills, but also being with families in a new way that helps families' nervous systems shift so that they can, again, use the tools that they're learning. So they can find, any listener can find all of this stuff just over on my website.
Okay. And can you say what the website is so that they know where to go?
Yes, it's just robyngobbel.com.
Great. And you have a podcast as well, correct?
Yes.
Okay.
Yep.
Awesome. And that they can access that there too. Good.
The podcast is on my website. The podcast is called Parenting After Trauma. So you can just search for it wherever you're listening to this podcast.
Good. Good. Fantastic. I know you'll have lots of new friends coming and benefiting from all of the really amazing resources you have available. Thank you so much for really all of the important work that you're doing in the world around all of this. And also for taking the time to spend with us today. We really appreciate it.
Yes. I mean, the same things to you. I know you're out, you do so much to support families all over the world. I'm so grateful for that and love getting to chat with you whenever I can.
And thanks as always to all of you for being here and for listening. We'll catch you back here next time.